Chapter 9, Treatment of Seizure Disorders. I'll skip over the key terms because we will go through them in the chapter. Epilepsy is one of the oldest known brain disorders and was described as early as 3,000 years ago in ancient Babylon. The word epilepsy is derived from the Greek word for attack because the ancient Greeks believed a person having a seizure was being attacked by demons. The World Health Organization estimates that 50 million people worldwide have epilepsy. Epilepsy is a type of seizure disorder that is associated with having experienced 2 or more seizures. Seizures are characterized by a sudden, excessive, disorderly discharge of cerebral neurons. Seizures may also be caused by conditions that range from injury to illness. Half of all seizures have no known cause. When the cause is known, the origin may be birth defects, infections like meningitis, AIDS, perinatal injury, malignant tumors, lead poisoning, head trauma, or eclampsia, a life-threatening condition that can develop in pregnant women. Wearing seatbelts, motorcycle helmets, and bike helmets can reduce the risk for seizures that are caused by head injury. The onset of a seizure may be preceded by an aura. An aura is an unusual sensation, auditory, visual, or olfactory hallucination that is experienced just before the onset of a seizure. In other words, the person may hear, see, or smell something distinctive immediately before the seizure activity begins. These signs of an upcoming seizure are important because they indicate the location of abnormal neuronal firing in the cerebrum. Flashing or strobe lights, such as those used in fire alarm systems, can trigger seizures in individuals with epilepsy. Febrile seizures in children are associated with having an infection, causing a sudden spike in temperature. Aggressive treatment with fever reducers is indicated to prevent more seizures. Most children who have febrile seizures will not develop epilepsy. External causes of seizures include metabolic disturbance, hypoglycemia, electrolyte imbalance, drug and alcohol withdrawal, and use of drugs that lower the seizure threshold. Stroke and heart attack can cause seizures because the brain becomes deprived of oxygen, which is called anoxia. There are 2 major seizure classifications, generalized and focal or partial seizures. Generalized spread across both of the cerebral hemispheres, while partial seizures are confined to a single hemisphere. Tonic-clonic, myoclonic, and absent seizures are generalized seizures. Tonic-clonic and myoclonic seizures start with a stiffening of the limbs and difficulty breathing and are followed by jerking movements with loss of bladder and bowel control. And on conclusion, the limbs become limp and the person may be disoriented. The jerking muscle movement associated with generalized tonic-clonic seizures is sometimes referred to as a convulsion. Petit mal seizures are also called absent seizures. This type of seizure is associated with a characteristic vacant or absent stare during the seizure. Absent seizures occur more commonly in children. They are barely noticeable to onlookers because no major muscle twitching is exhibited. Status epilepticus is a medical emergency that is characterized by repeated generalized seizures that deprive the brain of oxygen. Focal seizures are classified as simple or complex. Simple focal seizures may cause the arms, face, or legs to twitch, and visual, olfactory, or auditory hallucinations can occur. Complex focal seizures often begin with a blank stare. The person becomes disoriented and engages in repetitive actions during the seizure. When the seizure is over, the person does not have any memory of the seizure. When there is an abnormality in nerve signaling by neurotransmitters, seizures results. People with epilepsy have an abnormally high level of excitatory neurotransmitters coupled with a low level of inhibitory neurotransmitters. This accounts for the excess neuronal firing that occurs with seizure disorders. The goal of treatment of epilepsy and other seizure disorders is to reduce the incidence of seizures by suppressing seizure activity. The absorption of phentoin and carbamazepine is variable and influenced by particle size as well as by inactive ingredients and manufacturer's formulations. This influences bioavailability. Phosphentoin is converted to phentoin by enzymes in the blood. It has a short half-life of approximately only 8 minutes. Unlike phentoin, which can be administered orally or parenterally, phosphentoin is only available for parenteral use and is administered intravenously or intramuscularly. It is 100% available. Lamotrigine and levetiracetam are rapidly absorbed orally. Oral absorption of zonisamide is slow to moderate. All three drugs have greater than 95% bioavailability. Protein binding is less than 50%, so there are fewer drug interactions. Lower doses of lamotrigine are required when taken with valproic acid, and higher doses are required when taking it with an enzyme-inducing drug. Sedation, dizziness, ataxia, and nausea are all common side effects of the drugs. Phentoin and phosphentoin may cause hirsutism, excessive growth of body hair, especially in women, and gingival hyperplasia, excessive growth of gum tissue. Infants born to women who take phentoin during surgery may be born with a cleft palate. Phentoin may also decrease folic acid, calcium, and vitamin D absorption. Vitamin supplements will be probably recommended. Carbamazepine and oxcarbazine may cause double vision, bruising, and jaundice, and zonisamide may produce kidney stones. And again, drugs that inhibit ion channels are listed here with all of their dosage forms and strengths. Carbamazepine has quite a few different drug formulations. GABA is an inhibitory neurotransmitter. The GABA receptor regulates the movement of chloride ion into the neuron. Chloride ions are negatively charged. The influx of chloride ions inhibits formation of action potential, suppressing neuronal hyperactivity and seizures. Phenobarbital was the first drug used to treat seizures. It is indicated in the treatment of generalized tonic-clonic seizures and partial seizures, and it is administered in children to control febrile seizures. One of the mechanisms of actions for valproates and their derivatives is to enhance the inhibitory actions of GABA. The effectiveness of all valproic acid derivatives is expressed as valproic acid activity. All valproates are rapidly absorbed when administered orally and have 100% bioavailability. Up to 10% of the drug is passed in breast milk, limiting the use of it during lactation. Phenobarbital may produce hyperactivity rather than sedation in children. Divalproex may cause double vision. Phenobarbital, diazepam, and clonazepam can all cause tolerance and independence. They're all controlled substances. Respiratory depression is a serious side effect of phenobarbital and intravenous diazepam. Diazepam and clonazepam may impair learning. And again, we have a table with drugs that potentiate GABA and all of their different dosage forms. I have topiramate highlighted. That's a very common oral administered drug with all of these generic or brand names. Trokendi, Topamax, and Qdexy. Prescriptions for phenobarbital may be written using the grain strength, so we should know how to convert grains to milligrams, and we should check the label from the manufacturer to see if we should use the 1 grain is equal to 60 or 1 grain is equal to 65 milligrams. And for the most part, the general rule is if it's something to do with Tylenol or aspirin, we use the 65. Pramiphenol is a glutamate antagonist that is used to treat partial onset seizures with or without secondary generalized seizures. It is the only drug in its class. It inhibits glutamate, the primary excitatory neurotransmitter in the central nervous system, which reduces the generation and spread of seizures. It is rapidly absorbed when taken orally. The rate of absorption is reduced if it is taken with food, but the extent of absorption is not affected. Dizziness, fatigue, irritability, falls, nausea, ataxia, gait disturbance, weight gain are some of the most common side effects. The FDA does require a box warning in the product label because of hostility or homicidal thoughts. So in this box, we have the glutamate receptor antagonist, the only one in its class by Compa. And in the miscellaneous category, we have Brivact. And then we have the summary of drugs used in the treatment of seizures. We have all the warning labels in this table. So drugs that inhibit ion channels, they all should have alcohol, avoid alcohol auxiliary labels, may cause drowsiness, may impair ability to drive, do not discontinue without medical supervision. As always, anything that is extended release should not be crushed or chewed and should be swallowed whole. List the ones that should be taken with food. Gabapentin and phentoin should be taken with avoidance of antacids. All suspensions that are liquid should be have the auxiliary label shake well, and chewable tablets should be taken with a full glass of water. Pregabalin can be habit forming. And drugs that potentiate GABA may cause drowsiness, may impair ability to drive on all of those medications. We should avoid alcohol on quite a few as well. Again, we are not going to discontinue without medical supervision. Swallow whole, do not crush or chew extended release capsules or tablets. Take with food, Divelaprox, Tigabine, and Vigabatrin. And maybe habit forming phenobarbital, clonazepam, and diazepam. Drugs that inhibit glutamate can cause drowsiness, may impair ability to drive, avoid alcohol, and don't discontinue without medical supervision. Brivact may cause dizziness or drowsiness, don't drive, and the oral solution should be stored at room temperature.